we always said if we made it to the NICU, we'd be the happiest parents here, so.
Reaching this moment in the Riley Children's Health NICU has not been easy for baby Owen. His parents face the fear of losing him.
He would not have survived if he was delivered somewhere else.
This all began when he was diagnosed with a large mass on his neck while mom Katie was still pregnant.
We really didn't know if he would even make it to labor.
The mass was larger than Owen's head. Imaging showed it impacted his airway, which brought into question whether he could even be intubated after he was born.
It's actually very rare. There's been less than 150 cases that have been reported.
These are the most complex deliveries that we have.
A plan was made to perform an exit procedure. This meant Owen was partially delivered via C-section. His upper body was out, his lower body still inside the womb. He remained attached to his mom through the placenta to keep him alive, while the Riley ear, nose, and throat specialist worked to intubate him.
While we're doing that, I'm holding his head in my left hand, and I'm watching with ultrasound on his little bit of his chest that's out. I'm watching his heart rate. Stayed very steady throughout the time. That tells us that the placenta that's still attached, that's still giving him oxygen, is still doing its job.
In 19 minutes, the team made it happen. Dad, Dustin, remembers the moment the nurse came out and told him the process was successful. His baby was alive.
And when she came back, she was smiling, so that's how we knew it was good, and she told us, and we were all very happy. Lots of tears, lots of relief.
So I was able to learn when I woke up. Dr. Kreitz was holding my hands and looked me in the eye and told me that he was alive, he was able to be intubated. I came down here, I just sobbed. I was so relieved that he was intubated. I was so thankful he was here with us, but I just could not stop thinking, like, this poor baby, this poor baby having that huge tumor on him. I'm sure he was incredibly uncomfortable. And seeing him just having any type of pain from it was really hard.
His tumor was so big that it really displaced his carotid artery, which is a very big major vessel supplying blood from the heart to the brain, all the way to the side.
The next step for Owen was a surgery to remove the mass.
So the borders of the mass was very well encapsulated, well circumscribed. That led us to have a very straightforward, safe surgery, and the whole surgery took about 2 hours or even a little bit less.
We just kind of knew we had the best of the best, so we were doing all we could for him.
It meant everything to us that we could be here, have everyone under one roof.
Now Owen is recovering and enjoying little moments cuddled in his mom's arms.
He's so tough and so resilient.
It really has been, a relief to know that all the things that we wanted to happen for Katie and for Owen and for Dustin, the whole family has worked out the way we had hoped for.
We'll be grateful forever.